Hi, I'm Jane Austen. We're here with Chipper, and we are doing really birth prep yoga posture. So I've got a mama here who's like 40 weeks pregnant. Yeah, she's gonna have her baby super soon. She found that a lot of these poses that she practiced in the prenatal yoga were helpful in labor for her first birth. So we're gonna do them again. Hallelujah. So what we know about a pregnant woman's pelvis is that it's the ligaments that attach the bones to one another are really, really mobile in pregnancy, which is purposeful because that allows the pelvis to really open up. And a lot of times women will choose positions for birthing in which their sacrum, which is the triangular shaped bone at the bottom of the spine, can actually move. And sometimes we think about the sacrum like a floating bone, right? So we're gonna show you a few poses today that are gonna be able to open up the bottom of the pelvis, and poses that you absolutely can use to help facilitate the birth of your baby and allow your baby to move down through the bones of the pelvis, hopefully with as much, as ease as possible. So we'll start in hands and knees. So the hands and knee position is actually really common position for women to labor, and you can imagine that it takes some pressure off the pelvic floor and the perineum. So we'll just start with some cat stretches here. So as you inhale, you lengthen the spine, you exhale, round. Super common, women will do this all the time in labor. Inhale, lengthening the spine, and exhale, round. And you can do that with your breath in whatever way feels good to you. So that's the inhale, and the exhale is the tucking of the tailbone. And inhale, widening the sit bones, lifting the coccyx away from the pubic bone. And then let's go ahead and drop the forearms down to the floor or onto the chair, whatever you want. And then we'll do our little pelvic tilts. So instead of using the entire spine, we're gonna focus a little bit more on the pelvis. So this is a great pose to help baby get situated in a really good position. So if you find that the early part of your labor is really, really long, sometimes something as super simple as shifting your position sometimes can shift the baby's head to get better applied to the cervix so they can get down through the bones of the pelvis. And let's make our way back up into hands and knees. And let's scooch forward a little bit so we're actually, the forearms can come onto a chair or whatever's comfortable for you. Yeah, and then let's go ahead and come into the shape again, just a little bit, just a couple times. So sometimes that feels good. Maybe even putting a little bit more support here. So we've got a couple of pillows here, and let's stick these on. And should I scooch this a little bit closer to you? Yeah, okay, good. And then let's come into the one-sided squat. So from here, yeah, take the left leg out to the side, and then just kind of lean into it a little bit. So opening up the pelvis a little bit, kind of lean in and out, shifting the hips a little bit. Let this feel good. Goes deeply into it as it feels good. So you can tell here that the bottom of her pelvis is beautifully open, plenty of room for that baby to get through. Yeah, and if it feels good, you can even rotate the hips around. So you can kind of go in an angle, or you can rotate the hips around. So whatever feels good, do that. And we're gonna go a little bit deeper into the shape. So might wanna walk the foot in a little bit. Yeah, so walk that left foot in and then spin on, yeah, and then open it up. Perfect, perfect, perfect. You can even scooch the chair a little bit closer to you. Yeah. So this is a great opening of the pelvis here. And you can move around in there, or you can hold it still, or whatever feels good. So kind of follow your instincts. So when a woman kind of moves instinctually, she will often choose the exact position that she needs to make room for her baby. So this movement, not scripted. She's doing that because it feels good. That's awesome. And let's come out of this pose and switch sides. And take the other side. Good, this chair's, yeah, we'll hold it there. And then kind of lean in and out, come back here. So sometimes it's helpful to have, a partner who's supporting you in the labor and birth process for sure. Or maybe a doula if you're familiar with doulas. Doulas are birth attendants that are helpful for women in the labor and birth process. Good. And then let's go into the one-sided squat. Yeah, absolutely. And then spin on the knee, bring the foot underneath you, let the sit bones go wide. Yeah, there you go. And then again, you can kind of hold the pose still or move it around. Do what feels good. So I always trust a mama to do exactly what she needs to do, opening up the pelvis. And sometimes mamas will even do this kind of spiraling movement of the hips. Yeah, the spiraling movement of the hips can feel really good, and women will instinctually do it in labor a lot. So let's transition. Go ahead and bring yourself back in to hands and knees. And let the knees go wide, and let's come into child's pose. So let's bring these pillows down to the floor and just come on into a child's pose. Knees wide, big toes together, and press. Yeah, you can even turn the head to the side. Beautiful resting pose to use in the labor and birth process. Great. To check out more videos,